let's talk about priorities. What are the technology priorities going into 2021?
So look, I think we are hopefully we are towards the end of pandemic. Our numbers are decreasing, so but I would say we are still very focused on COVID. Okay, I think our focus now has changed, turned from inpatient and more patients coming to the hospital to now how do we vaccinate. So we are spending weekends, evenings on mass vaccination, right? So and the needs are different. So we are focused immediate future on how do we register our patient in a reasonable way, in a safe way. How do we reach the populations electronically. So obviously, you think again, this goes back to our discussion of a digital divide, because you think about the best way to register and then vaccinate. If we have access to portal, we sign up on the portal, pick a date, and we will schedule in next 2 weeks from now. This is fantastic and ideal way. Fortunately, we have technology to make that happen, but not everyone has technology at their homes, and not everyone have access to it. So our priority immediately from a technology perspective is to make sure that we help not only Jefferson but also city of Philadelphia in southern Jersey public vaccination. I think a big area of investment, hopefully in the later part of 21 for us, is going to be on digital technologies. We were forced in a way to work from home and rely on a lot of virtual services. I think almost a year into it, we are thinking that this is going to be really permanent. I mean, it's quite possible that we are staying in some sort of a hybrid format. I'm very certain that it's going to be. We are not going back to our old ways. That I can share with certainty. So some of our work is going to be just around that. How do we cement, work from home? Some of the, for instance, technologies that are not cloud-based that require things like VPN access that works if you work like 1 or 2 days a week from home. But if you are doing your job and you're relying on services and old systems that are still hosted in our data center, it becomes problematic. So continued move to cloud, continued investment in digital. I think that there is a huge opportunity in improving, at least at Jefferson, and I think in general healthcare. What I think the common word I think is probably overused is digital front door. So there is going to be a big push, already is, but I think even more significantly, we are going to be pushing more towards digital front door. Automation is a huge priority. We kicked it off last year. We slowed down because of COVID. I think that that's going to be a big push in later part of 21. We are still sort of towards tail end of our implementation of EHR in some of our hospitals. So one EHR, we are fortunate that we'll have one EHR across our health system. That's something that's ongoing, and I'm looking forward to complete it. So a number of initiatives, but if I were to sum it up in one word, I would say digital.